My name is Dr. Chris Layton and I work at Chiro-Med Health and Wellness Centers in Orland Park, Illinois. We've been doing a series of informational videos and we're doing one today on cervicogenic headaches. Cervicogenic headaches are headaches that produce pain in your head or in your face, but the pain really comes from somewhere down below. It comes typically from the neck. It can be due to things like degeneration in the cervical spine, changes in the muscles, pressure on the arterial supply, or pressure into the nerves. We've got some x-rays up here that show some of the things that can cause the cervicogenic headaches. Here you can see C1 or the atlas vertebrae in the neck, and C2 and that rotational component. They should line up one over the other, and you can see the rotation here to the left. And it continues on down through the spine. You can see the degenerative changes or arthritic changes going on through the side of the neck. Here, their second cervical vertebrae. It's stuck in a flexed position. Their neck starts to curve here, but where it should continue, they've lost their cervical lordosis, or that normal curve of the neck. They have what's called anterior head carriage, or reversal of the cervical lordosis, because the neck is actually going the wrong way. It's starting to shoot forward. Here you can see in a flexion x-ray of the spine, as everything bends forward, C2 should start to continue to flex and the spinous should open up. They don't get that. And again, on extension, it should continue to go into extension and roll back, but it doesn't. This patient came in, typical cervicogenic headaches, loss of range of motion, pain in the muscles, with the headaches that she felt at the base of her skull, going around to the frontal part of her, skull, and even somewhat into her sinuses. The key to cervicogenic headaches is doing a thorough exam to determine the cause of the headaches. Is it coming from the musculature? Is it coming from spinal changes or bony changes? Is it pressure into the arteries? Or is it due to pressure on the nerve? Doing an exam, we can determine that and then determine the course of treatment. Cervicogenic headaches tend to respond well to chiropractic care. Alternative treatments, they tend to do Botox injections, trigger point injections, so needle involvement. We tend to use adjustments, muscular therapy, whether it's to loosen muscles up, lengthen them, or muscles that need to be strengthened to help regain that posture in the neck. Typical cervicogenic headaches should resolve in 3 months or less with typical chiropractic care.